Hello, everyone. Welcome back to the Viaka Podcast. This is where we bring you conversations with inspiring founders, investors, and builders who have ties to the MENA region, who are making waves in the entrepreneurship space around the world. Before we dive into today's episode, a quick word about Viaka. So we're a global platform that scouts, invests in, and supports exceptional MENA connected founders. Through our angel network of over 80 active investors, we've backed 10 companies since launching in March 2025, deploying close to $600,000 alongside leading US investors. We've democratized early stage investing with checks as low as $1,000. So, really, anybody can invest at this point, making it really accessible for operators, professionals who want to back world class talent. If you're interested in joining us, visit viaka.net or just email hello@viaka.net. Today's guest is Hashem Abdou, a founder who's on a mission to transform mental health care. After studying biomedical engineering and computer science at Harvard, Hashem co-founded Oasis, an AI-powered operating system that's making therapy measurable, data-driven, and less burdensome for clinicians. The company just raised $4.6 million, and Oasis was Viaka's actually very first investment. So we're very proud of that. Hashem also co-chaired ACH 24, the largest Arab conference in North America. Hashem, welcome to the podcast, man.
Thanks, Ramzi. Thanks for having me. Yeah, it's exciting.
Yeah, so in a previous conversation, you mentioned something about when you got started in entrepreneurship. You mentioned your first business essentially started when you were 15. My first business essentially started when I was 29. I started my first business, so I'm maybe a bit. I consider myself a bit late to the party. How did you get started at 15? What was that like? How did that get started?
Yeah. Yeah, definitely. It definitely started a bit early. I mean, my mom and my grandmother are both entrepreneurs, so I sort of grew up in this kind of, in this household where there was definitely dopamine of building something from zero. At 15 also, I think most of your life is generally pretty scripted. So, you go to school, you have exams, you have the pretty basic expectations of a 15-year-old, but there isn't much wiggle room generally day to day. And I think from a very young age, I was sort of addicted to this feeling of, call it control, call it adventure, but basically just being able to have a say. I think that was something that I was always really excited about. And when I got a chance to sort of start this project with a couple of friends from school, it was the first time that I really was able to feel that sort of sense of control and decision-making authority as a 15-year-old. And that was something pretty exciting. So it was definitely that realization that, the world is not fixed. It's pretty negotiable. And it's pretty up to,
This is during high school, I'm assuming, right?
Yeah, exactly. Mm-hmm. Yep.
And so what was the business? What was it about?
The business, it was called Zip and Flip. So we were making these eco-friendly beach bags, beach towel bags. So they were kind of like beach bags that you can unzip into towels when you take them to the beach. It was sort of like a funky consumer product, nothing too technical or anything like that. But it was honestly a lot of fun. I mean, we went out to manufacturers in Cairo. I grew up in Cairo, so this was in Egypt. But we'd go around, find tailors and find different manufacturers. And then we got our first sort of assembly line at this factory that was the factory of a friend of mine's family, actually. And so kind of going through the whole process and then, changing the design, which then led to, better sales and working on your pitch and striking our first corporate deal. So all of those were sort of fun parts of the project. And yeah, it was a lot of fun, honestly. It was just me and a bunch of my friends. And then, we did relatively well. We won a bunch of, startup competitions. The product went somewhat viral one summer. Obviously, it's kind of a seasonal product because it's more of a beach product. But the summer season in Egypt is very long, so it was fine.
What year is this? Do you remember?
It was 2016 through 2018, pretty much. Yeah.
Okay. Okay, so 10 years ago, yeah. So I mean, this was before. I mean, was viral a thing back then? I mean, if Facebook was picking up, right?
It feels like it was so long ago. I think Facebook was definitely a thing. Actually, I think it was like even post Facebook heyday. It was like Instagram was the big thing. I mean, probably still is the big thing, but Snapchat probably also. So that was kind of that time.
And how did you get the idea? You and your friends. I mean, you're kind of you were thinking like this is could be a company. This is like what are you just doing this for fun? Is it just like winging it? Like what's the plan here?
Yeah, it came out of a club at school, like this entrepreneurship club called Injaz. Um, and
Mm.
uh, and so we, it was just a bunch of us who were part of the club, and then did this. We won the sort of Injaz competition for startups locally, and then traveled abroad and also won sort of the regional competition as well. And so then it kind of turned into this. Legit sort of like school project turned somewhat of a startup, and we actually got some investors and raised money and sort of formalized it a little bit more. But it all came from that club at school, and so inherently from the very beginning, it was all just friends of ours, and classmates that were part of it. So that's kind of where it came from. But um, yeah.
Nice. And how did that go? Did that affect your decision to what you're going to be doing in university at all, or was entrepreneurship like a thing you wanted, like you kind of saw yourself doing? How did that pave the next step?
Yeah, it definitely shaped what I wanted to do for sure. Not necessarily from a industry perspective and what we were working on per se, but more so just this feeling of you're building something with your own hands from the ground up. This sort of 0 to 1 feeling was incredibly addictive, and I think ever since then, I knew it was something I wanted to do full time always. And I had a couple of different experiences, throughout college and different kinds of internships and things like that. And I think what I always gravitated to most was this sort of super early stage, like really involved, really high impact type of work, much more so than being in the corporate world or anything like that.
Okay. Okay. And during university, I mean, you studied something. It wasn't. Was it in entrepreneurship at university? You studied. What did you study in university?
No, I studied biomedical engineering actually, and computer science. So very different. We
Very
didn't
different.
have, uh, yeah, we didn't really have like business or entrepreneurship, major in college at Harvard. And so I was always interested in healthcare, always interested in bio actually. I was also really good at biology in high school, so I always felt like maybe this can be my thing. Thought about doing med school for a little bit. I was actually pre-med at the beginning in college, but then I think this sort of startup itch overcame that interest in medicine a little bit more. Um, but yeah, I studied biomedical engineering mostly because I was just really interested in tech and what you can do with tech within the world of healthcare. And so I think from even in high school, I sort of knew I wanted to do something related to this field of health tech or digital health or maybe even med tech. Um, so that's ultimately what I ended up studying. But I was definitely quite involved with a bunch of the startup and entrepreneurship clubs and groups around campus. So it wasn't like a major, but it was definitely a community that was there that I tried to be a part of as much as possible.
Yeah, so it's funny. You're kind of doing biomedical, but you're also still in touch with entrepreneurship. It's almost like, hey, I don't want to, there's something here that later on became something pretty big, right? It's almost like I'm doing this, but I'm not letting go of this at the same time. So there has to be something. Okay, and so you
Exactly.
graduate,
Yeah.
and then what are the things that came next?
Yeah, I mean, also part of it obviously is like, I grew up in Egypt and like uh there's always this like subtle inherent pressure of like, oh, you want to be an engineer, and my
Of
dad is an
course.
engineer and my grandfather's an engineer, and so that was always also part of it. And so I wanted to make sure I wasn't letting go of that completely. But I always knew that the application of that was in the startup world. Um And there were a couple of experiences that I had throughout college. I think that really solidified that conviction in that was what I wanted to do. I had a couple of corporate internships, which I really didn't like. The experience was always good, and I think I generally learned quite a lot, but I didn't feel like that was the environment that I would thrive in. And then others that was really.
What about it? What didn't you like?
Yeah, I mean, it's a good question. I think it was the lack of agency and the lack of autonomy and the lack of feeling like you were doing something impactful, probably. I mean, it's a pretty generic answer, right? But I think those things, especially when I had a taste of it already, and knew that it was possible and feasible to actually be able to just kind of do your own thing. I always felt like it would be sort of a wasted opportunity to give up that option when it was there. And I mean, I'm obviously very grateful for the stars that kind of aligned to give me the opportunity to be able to just like jump right in and take a risk. And my parents were always very supportive, so I'm also very grateful for that, of course. But because that was an option that was very much available to me, I figured like it would be ridiculous not to take it.
Okay, so you did a few internships. Maybe did you end up at a good job? Like how did that?
Yeah. I mean, I worked at a couple of startups, some in Cairo, and then some in the US as well. A lot of them were in different industries. I did a little bit of fintech and a little bit of health tech, ed tech also at some point. I think the common theme or the common thread throughout those was the fact that I really enjoyed that stage and that type of work more so than necessarily that industry. And then I also worked in corporate, I think, as more of just like telling myself, okay, you are able to do this if you wanted to, but maybe it's good to not now that I had the opportunity. I mean, and in college, most of my friends and people around me were always obsessed with like consulting and banking and trying to get into, to end up on Wall Street. Post grad. And so naturally that sort of, became something that I wanted to do just to kind of prove to myself that I was able to get that job. And I think as soon as I got that, trading job or consulting job, I realized, okay, now that it's possible, it's a good opportunity to just sort of completely jump ship. So that's really the purpose that served more than anything else, honestly. It was this probably like kind of self-validation that I didn't know I needed, but was a good sort of boost of motivation to be like, okay, you got this. Let's do something else.
And what is this something else? Like, how did you get to Oasis from where you were? So maybe kind of what's the story?
Yeah. I mean, there were a couple of things that led to Oasis the way that it is today. I think the first one is, my mom is a clinical psychologist. So I grew up very close to the world of mental health and therapy. But of course, grew up in Egypt also where, generally, obviously I'm oversimplifying it, but the general sentiment I would say is, going to therapy generally means something is wrong with you. And there's quite a bit of misunderstanding, call it, stigma or taboo or whatever you want to call it in society and general cultural context. But so it was always interesting, sort of like this, dichotomy of, it being very much front of mind at home, but also pretty misunderstood generally. And then I came to the US and it was sort of the opposite extreme where, at least, in Boston where I went to college or now in New York, mental health is completely destigmatized, which is, I think, incredible. But honestly, sometimes over medicalized even, especially here in the US. I think, everything becomes a label, everything becomes a diagnosis. And so generally sort of this human story that is mental health and this holistic picture of how someone is doing, psychologically, just gets flattened often into what they call the DSM codes or, insurance reimbursements. And there's a lot of structure around it that I think makes it quite reductive. So it was sort of that failure on both sides that was interesting to me. On the one hand, the under recognition and the stigma, but on the other hand, this like over over like clinicalization almost and systematization, if that makes any sense. So that's really kind of where Oasis came from. It came from this idea of, wanting to try and make mental health more of an objective and measurable and data-driven field, and sort of bringing that same precision that you have in medicine elsewhere to mental health. So yeah, I mean, biomedical engineering played a role for sure. I think my thesis in college was building a microfluidics wearable similar to a Whoop or any of those sort of wearables, and Whoop similarly came out of Harvard, with Will maybe 10 years earlier. But I was trying to do something similar, but to track, physiological biomarkers that were trackable through sweat, like cortisol, for example. And I think the conclusion was really interesting. It was that physiological biomarkers can very well and pretty accurately be mapped to mental health outcomes.
Did you want to build something did you start out as consumer and then it moved to a platform? Like, how did things change along the way?
Yeah, it did start off as a consumer app. The very early versions of Oasis was selling to individual, people on the App Store, trying to get them to integrate their wearables and other kinds of data, and then try and give them some sort of insight. And what we noticed was that wasn't really solving the problem necessarily. I think the big, almost like aha moment for us was realizing that clinicians and providers and therapists are the ones that ultimately control the patient flow, but also are the distribution layer. So if you can just sell to them directly and have them sort of be your champions almost, then all of their clients and all of their patients, current and future, can be then a part of your ecosystem by default, without you having to go out and build a consumer product, which, in my opinion at least, was more difficult and not really what we were most excited about. We weren't as excited in initially building this company in the consumer sort of space as much. I think it's almost like a different skill set to build a consumer product, especially one like that where there are many sort of alternatives or many options. So yeah, I think the hypothesis was, let's build the infrastructure layer for therapists. Instead of building just another app, let's give them something that they need day to day, so that they can basically run and streamline their operations on our platform. And by doing so, we can then absorb all of this data from their basically like practice and from their sessions, and then sort of like also be able to get the patient side as well. Because I think if you own the workflow, then you can integrate the intelligence on top of that. Whereas if you are trying to like slap something on top or provide like an additional thing, then if it doesn't connect with the ultimate sort of source of truth of where all of that lives, it's really hard to really make sense of it or make use of it, because it's not your data. It's not, you don't generate it.
That's so much work though. Like, I mean,
yeah, it is.
You started out with like, hey, let's make an app and like a wearable, and if it works, it works. If it doesn't work, great. But now you're like, forget that. Let's build the ground for all of it.
Literally. Yeah, I know. I mean, to be honest,
build it all.
It's yeah. If I had known how much this would have entailed before we had sort of, gone right into it from the very beginning, there probably would have been a better approach to get to where we are right now. The product is massive. Yeah, there's definitely a huge surface area of stuff. And it all kind of like, we started off with one thing and we positioned ourselves as like, hey, we're the operating system. So if you use Oasis, you don't need to use anything else. But obviously the flip side of that is everything needs to be there and working very well. Otherwise they will need to use something else. Right. So, as we started to get more and more of our early customers, there would always be things that we still didn't quite have. And the only solution, just like in the way that we saw it, was for us to build it out, because otherwise, they would just go somewhere else. And the whole value of our platform is that it's a one-stop shop, and we kind of like, you can trust us to handle everything for you, both operationally and clinically. So it's almost like you're as strong as your weakest link, or whatever the saying is. Because if there's one thing that just isn't working as well, or if there's a better alternative out there for one part of the workflow, they'll just go and use that. And then the whole point is that, the whole purpose is sort of defeated. So yeah, the short answer to your question is, yeah, it's definitely a lot.
Yes. So maybe just briefly, so what is Oasis today? Give me an idea for what it is.
Yeah, Oasis it's an operating system, which obviously is a buzzword, but what that means is that we try and supercharge therapists and clinics, both operationally and clinically. So we help them with all things, admin, so billing, insurance, scheduling, intake, managing your clients, actually running the session, documentation, compliance. So everything from, when you first get a new client all the way to, like, you're running your sessions with them, you're scheduling future sessions, you're, analyzing, you're reporting. So all of that we do on our platform, as well as at the core of it is this piece of, sort of measurement, and trying to improve clinical outcomes using better measurement and better data. So, as a therapist, you can have your clients integrate various, wearables and devices and metrics and all that kind of stuff. And it's all fed into this continuously evolving context layer, AI, which uses that data to help you with clinical decision support as a provider. So, you can ask it questions, it can flag any anomalies, it can do, change tracking and sort of basic machine learning stuff where we are today. And I think over time, the more data and the more usage this gets, the better the insights and the recommendations and the, reduction of misdiagnosis rates, all of that sort of compounds over time. So that's kind of the bet that we're trying to make.
What were the alternatives to that? What were therapists doing before?
At least in the US, it's so we operate mostly in the US and Canada. But in the US, at least, it's definitely like just a fragmented sea of different solutions that people have, pieced and puzzled together. So, you have generally your EHR, which is sort of the core of the platform, which stands for electronic health record, or electronic medical record. Some may refer to it as that. And that's basically the sort of the core, foundation of like where your client records live. And so that's where you put in the diagnosis, the notes, the, information about, who they are and their medical history and all that kind of stuff. So generally the EHR is like, step one or the foundation. And then on top of that, there are a bunch of other, tools that you might need. So you need obviously a calendar, and then you need a telehealth, platform. So because Zoom usually, needs to be HIPAA compliant and all that kind of stuff. And then nowadays there are the AI scribes, which will transcribe the session for you and help you generate the note in a, clinically rigorous and compliant format. And then you get into billing. And so billing is a whole different world, especially with insurance. So building like a revenue cycle management product was a whole different, sort of arc, as well. But generally, I think most therapists, even like clinics, will have sort of a combination of multiple different tools, or they'll use like one of the sort of legacy practice management systems, as they call it, which try and combine some of those things.
Okay, so you're building all these, I'm going to call them modules. They're probably not called modules, but are you building everything?
Yeah, we're building everything because at least within mental health and behavioral health, I think in this age, especially today, with AI and all these coding tools and all these things, like we've been able to actually build quite a lot of product very quickly, and at a pretty, strong level, with obviously the help of a lot of these tools and assistants and agents and things. And we have a pretty lean engineering team, but ultimately, our take has always been, we need to sort of build all of the individual components so that it actually can be useful. And that the most of the value comes from the fact that it is comprehensive, and not just that any individual tool is better than what else is out there.
And how do you acquire users? Is it one therapist, they add all their patients to it, or do you how does it work?
Yeah. so our sort of ICP is both individual solo therapists and then also clinics and practices and group practices and things like that. So each of them have a slightly different customer acquisition sort of strategy and model and stuff. But generally, yes. So we will go sell to the therapist, whether it's a group or an individual, and they'll then migrate all of their clients and their patients. And so yeah, it's sort of a one to many. We go to the one therapist, they bring all their people. And I think over time, we're also building a little bit of a marketplace as well. So right now, we don't really sell, D2C at all. We don't necessarily target or have any marketing for individual, people or clients. But in theory, you could sign up as an individual and then also find a therapist within Oasis as well. So there is an element of that. Which I think down the line could be interesting as a way to sort of also generate demand for the providers. But yeah.
Okay. And is it like, how are you? What are users saying about the platform today? Like, what's some feedback that you're getting from users about the platform?
I think the feedback has been pretty remarkable. Just in how much we can help save them time and energy and money spent on a lot of the admin stuff. And I think that's generally step one of like the real value that we can provide and the ROI. The ROI comes from time saved and additional money and revenue that you can generate as a provider. And then once you've solved that, then you can start thinking about how do I improve patient outcomes. And it sounds like honestly, it sounds a little bit, maybe, I don't know what the word is, like kind of dystopian almost, but when we talk to so many therapists and so many providers, like the improvement in patient outcomes is a third priority, a distant third priority after like saving time, making more money. And then, if I can go home early or if I can, make an extra, $1,000 a month, then I'll start thinking about how I can improve outcomes for my patients. Obviously I'm being like a little bit reductive, but, that's generally like, at least when it comes to selling a product, a lot of the feedback that we got initially. And so the cool thing about what we've built is that because it's so clear how we can, help save people time and make them more money even, the next step or sort of the third step of like, okay, now let me focus on actual patient outcomes and how I can measure outcomes and how I can improve, treatment and care, then starts becoming more and more of a priority. And ultimately that's our goal. Our goal is to build a platform that helps people, deliver better care to their patients. At the end of the day, that's really all it is. And so, the fact that people can now start thinking about that as being a problem or a priority is, I think, a pretty good unlock.
What's the approach to measuring outcome through collecting all this data from all these different places? Like, how are you finding, how are you measuring the outcome, which is essentially what you started out, you wanted to do. So how are things evolving, or how are things improving?
Yeah, I mean, that's a great question. And that's like really the golden question. It's like, how do you measure outcomes? I think there's this sort of like, there's a difference in the way that insurance, reimburses sessions that I think is an interesting way to, as an interesting analogy. There is sort of fee for service, which is the standard today, which is that, you conduct a therapy session as a provider and then you get paid whatever it is, $120 from the insurance provider in exchange for that session just having occurred. And then there's this thing called value-based care, which is a new paradigm for the most part, or maybe like newer in mental health and behavioral health. It exists, in other areas of healthcare quite a bit, which is basically that, you're getting reimbursed, you're getting paid for patient outcomes, not just the sessions. And so if your patients are getting better, you make more money as a provider. And there's been a general, shift and prioritization of value-based care throughout the healthcare system here in the US, especially. But the big challenge within mental health and behavioral health is that it's very difficult to measure outcomes because it's such a subjective and such a it's a very subjective field, right? So like, how do you measure outcomes? Like, what does it mean that I'm getting better if I have, depression or anxiety or anything else? Like, how do you track that? How do you measure that? And so obviously it's been very difficult to do any sort of value-based care in this world. But what we're trying to do is to show that, by collecting the right type of data, at scale, you can actually train machine learning models and AI models that can really help you understand outcomes, improve outcomes, and also be able to, predict and even prevent outcomes. So step one is just measurement. And that's where we are today, which is what data do you need to collect and track to be able to measure anything? So usually it's a combination of a lot of things, right? So it's like some amount of physiological data. It's obviously a lot of data from, the therapy session or, the notes that the provider will write. It's also things like, mood logs or journals or self-reported data. And then come the, standard, what they call quality measures or the assessments. So that's historically the standard for measuring outcomes in mental health. It's these, it's called like the PHQ-9 or the GAD-7, which are, depression or anxiety surveys. These are generally like, 7 to 10 or whatever, how many questions. Very, very, simple questions, but as generally meant to be used as a way to sort of measure outcomes. So what we're saying is, that is one way to measure outcomes, but the combination of all of that data and all of those different metrics are a much better way of actually measuring outcomes because it's just much more holistic information. So invariably, like the more information you have about how someone's doing, the better you'll be able to measure and track how they're doing, right? So on a very simple, like kind of simple level, that's sort of the hypothesis. But the challenge is like, this needs to be a standardized approach. Like we can't just be the only ones who are saying, integrating like, HRV and sleep data into your understanding of like outcomes is good. Like even if that is a better way of measuring outcomes, everyone needs to use that. Otherwise it's not like you're measuring things with a different ruler, right? So it's, So the name of the game is to make that sort of the standard of measurement, and that's the challenge, and that's probably why we're still multiple years away probably from some sort of like successful value-based care in this space.
Okay, so would you say you're a bit early today? You're just doing the measuring, or do you have maybe an example of how things could improve? Like, do you have an example that you can give me of maybe just very simple, like a patient has this month one, this is these are their markers, or month two. So maybe just a simple example.
Yeah, definitely. I think the simplest way to think about it is like within specific focuses within therapy or mental health. Like my mom, for example, focuses on or specializes in sleeping. So the name of the game is so for sleep disorders, like having access to sleep analytics, whether it's through like a wearable or something else, is really helpful because for the first time now you're actually being able to track objectively how someone is sleeping versus like having to rely on that patient coming into the clinic and telling you, hey, I think I slept well, or maybe I think, so it's a whole different, understanding. And that's like obviously just one very specific vertical. But then when you couple that with, certain scores on assessments have increased over the last couple of weeks. Their, sleep data is looking better. Their activity levels are up. And then also, their mood journals, which they do through our app, show a general positive sentiment towards like X, Y, or Z thing. So you can use all of those sort of like different data points that seemingly are very disparate and very difficult for a human to be able to like synthesize and aggregate overall as just like such a wide range of individual data points. But with AI now, you can actually like extract signal from that noise. And that's really what's powerful. So you can take like, weeks and weeks or months or years of wearable data or of session notes or of whatever like the source is, and you can actually start making sense of it, where before you just wouldn't never be able to extract anything meaningful from all of that mess, essentially.
What does the team look like today in terms of co-founders and team structure, and how many people are on the team?
Yeah, we're three. There are three of us co-founders. So one of them was my roommate freshman year at Harvard, and then the other one is a good friend who's been a friend for a while. So it's three of us, and then we have a team of an additional 7 engineers. Or not additional, sorry, we're 7 in total. So we have 4 additional engineers.
Oh, okay, very small
and
team.
so that's basically the full team. Yeah, very small
Pretty
team.
small.
And actually, all of the engineers we brought on in the last month, or 2 months. So pretty lean.
Very cool. What's the vision moving forward? What are you guys looking to do in the next maybe year or so?
Yeah, I mean it's a good question. The next year is all about we want to be the platform of choice for any mental health or behavioral health clinic in the US. I think that's our short-term goal. Anyone who's looking to start a practice, grow their practice, move off of whatever legacy, existing platform they use, we want to be like the premier sort of behavioral health operating system. And so I would say that's the short-term goal, is just, continue to get this in the hands of as many people as possible, continue to get feedback, iterate on the product. And then as we're doing that, building out our data set, building out our ability to make sense of the data more and more, and then going from there.
Nice. Very interesting. We're just coming up to the end of our conversation here. Maybe just to kind of wrap up. So Oasis was actually the very first investment that Viaka has made. How did that happen? How did that conversation happen? I'm keen to kind of hear the behind the scenes a little bit.
Yeah, Viaka has been great. I mean, they were one of our earliest supporters. I met Henny through another VC friend, actually, and then sort of like got in touch with Henny, connected, sort of hit it off pretty instantly. And then at the time, they were just starting off with Viaka Capital, which is the angel network part of Viaka.
Mm-hmm.
And so I initially joined Viaka as sort of just this community at first, and they had the group chats and all that type of stuff where there were Arab or just like in general MENA based founders in the US, or people within the startup and VC world. So it was just a really helpful and like kind of refreshing community to be a part of. Excuse me. And then Henny approached me with the idea of, we're starting this, Viaka Capital. Would you be interested in like, talking to the angels and seeing if there's interest in potentially like an investment in our pre-seed? And so we did that. And yeah, ever since, Viaka have been strong supporters of ours, and we sort of love these guys and the community. So it's been great.
Great, amazing to hear. Maybe just a final question. What's something you wish you knew when you got started about building Oasis?
Oh, wow. That's a good question. There are certain things that I'm glad I didn't know. I would start there. There are certain things I'm glad I didn't know about the space. Yeah, truly. I mean, I think being a founder, and especially a first time founder, and especially someone who didn't really, I didn't really spend that much time, working at a startup or like, really learning the ropes as much. So it was kind of just like jump right in and figure it out. And I think that being naive to think that it's doable was probably such a blessing, because I didn't appreciate how many difficulties and challenges and barriers and setbacks there would be. And I'm not saying that at all to sound pessimistic. It's quite the opposite. I really think that, those are the things that, and I mean, it sounds super cheesy, but truly, I think like those difficulties and the challenges, and kind of being thrown into the thick of it without really knowing, all of what it entails is the number one best way to learn, and the best way to, to really like develop a thick skin and be able to, just kind of make it happen. And I think the biggest thing that has helped me throughout that process. And someone kind of told me this early on, but it really resonates now. It's that, you kind of look at all of those difficulties and setbacks as just the current problem of today. I think that's like a phrase that I really like. It sounds super simple, but it's easy to think of things as like super existential and people aren't buying the product, or I can't build it out, or the tech isn't working, or it's buggy, or it's, whatever the problem is and especially early on, it sounds like it can be super existential and like, oh my God, what am I doing? Like, should I have been working at,
we're going to die.
Anything else? And it's so easy to think like that. But I think at the end of the day, you just kind of have to look at it as like, you know what? Like, there's always going to be problems. It's never going to get easier, by the way. Like, it's probably never going to get easier. And so this is just the problem that I have right now, and I'm going to solve it, and I'm going to figure it out. And then once I do that, best believe there's going to be a whole new set of problems.
Yeah, I always used to tell myself in my first company, I was like, look, the problems are not going to get easier. They're only going to get worse. So if you can't handle this
exactly
forward, like, good luck. So just better, like, get some thick skin, and
100%.
It's only going to get worse.
100%.
Did you guys
100%? And honestly, like, did we what? Sorry?
Did you guys get sued yet? I hear the big.
Yeah, honestly, we didn't. Not yet. Fingers crossed that doesn't happen soon. No, not yet.
I hear every.
But then again, I think if you do get sued, you're probably doing something right.
Yeah, exactly. So. Like, I haven't heard of a really big firm that didn't get sued and had to.
Yeah, 100%. Yeah, we're waiting for the day. Yeah. Hopefully not anytime soon, just because we have so much on our plate, but I'm sure it'll come.
Hashem, man, thanks a lot for being on the podcast. It was a pleasure having you, getting to know you, and understanding a little bit more about Oasis. Where can people find you, on LinkedIn or? Yeah, LinkedIn. That's where I'm most active, honestly, or even email. But yeah, LinkedIn works. I'm just Hashem Abdou, and yeah, it was a pleasure, Ramzi. Thank you so much. It was a great conversation. Pleasure. All right. See you guys. Bye-bye. Awesome. Take care.